The cerebellum. Position. Lies above and behind the medulla and pons and occupies posterior cranial fossa. Its surface is high convoluted, forming folds or folia, being oriented transversely. Cerebellum. External features. Consists of two cerebellar hemispheres united in the midline by the vermis. External features: 3 peduncles. Inferior cerebellar peduncle connect with medulla and with spinal cord, contain both afferent and efferent fibers. Middle cerebellar peduncle connect with pons, contain afferent fibers. Superior cerebellar peduncle connect with midbrain, contain mostly efferent fibers. External features. Tonsil of cerebellum, 2 elevated masses on inferior surface of hemispherical portion just nearby foramen magnum. Lobes, 2 deep fissures, 3 lobes, primary fissure. Uvulonodular fissure. 3 lobes. Flocculonodular lobe. Anterior. Posterior lobe. Lobes, anterior lobe, corpus of cerebellar, primary fissure. Posterior lobe. Flocculonodular lobe. Posterolateral fissure. Internal structures: white matter, gray matter, cerebellar cortex. Cerebellar nuclei. Dentate nucleus. Vestigial nucleus. Emboliform nucleus. Globose nucleus. White matter. Internal structures: vestigial nucleus, cerebellar cortex. Globose nucleus. Dentate nucleus. Emboliform nucleus. Medullary center, deep nuclei. 1. Vestigial nucleus. 2. Globose. 3. Emboliform. 4. Dentate. 3 functional divisions. Vestibulocerebellum. Archicerebellum. Flocculonodular lobe. Spinocerebellum. Paleocerebellum. Vermis and intermediate zone. Cerebrocerebellum. Neocerebellum. Lateral zone. Vermis. Intermediate zone. Lateral zone. Flocculonodular lobe. Cerebellar divisions: spinocerebellum, vermis, intermediate hem. Vermis plus intermed hem. Control of limbs and trunk. Lateral hem. Cerebrocerebellum. Cerebrocerebellum. Lateral hemisphere. Planning of movement plus. Fourth vent. Flocculonodular lobe. Vestibulocerebellum. Flocculonodular lobe. Control of eye and head movements. Balance. Connections and function of cerebellum. Vestibulocerebellum. Connections. Afferents, receive input from vestibular nuclei and inner ear. Afferents, projects to the vestibular nucleus, vestibulospinal motor neurons of anterior horn. Function, involved in eye movements and maintain balance. Connections and function of cerebellum. Spinocerebellum. Connection. Afferents, receive somatic sensory information via spinocerebellar tracts. Afferents. Fastigial reticular and vestigial vestibular pathways, vermis projects to the vestigial nucleus, vestibular nuclei and reticular formation, vestibulospinal tract and reticulospinal tract motor neurons of anterior horn. Intermediate zone projects to the interposed nuclei. Globose emboliform rubral pathway, contralateral red nucleus, rubrospinal tract motor neurons of anterior horn. Function, play an important role in control of muscle tone and coordination of muscle movement on the same side of the body. Connections and function of cerebellum. Cerebrocerebellum. Connection. Afferents, receives input from the cerebral cortex via relay and pontin nuclei, corticopontocerebellar pathway. Efferents, dendrothalamic pathway. Dentate nucleus contralateral thalamus primary motor cortex corticospinal tract motor neurons of anterior horn. Function, participates in planning movements. Summary: cerebellar efferent fibers, globosymboliform rubral pathway. Dendrothalamic pathway. Vestigial reticular pathway. Vestigial vestibular pathway. Summary: cerebellar afferent fibers. Afferent fibers from cerebral cortex, corticopontocerebellar pathway. Afferent fibers from spinal cord, anterior and posterior spinocerebellar tracts. Afferent fibers from vestibular nerve, pyramidal tract and associated circuits. Upper motor neuron. UMN. Cerebellum. Basal. Ganglia. Pyramidal tract. Lower motor neuron. UMN. Cerebellum function maintenance of equilibrium. Balance, posture, eye movement. Coordination of movement of. Walking and posture maintenance. Posture, gait. Adjustment of muscle tone. Motor learning, motor skills. Balance. Motor skill. Pablo Casals. Cerebellum clinical syndromes. 1. Ataxia, incoordination of movement. Decomposition of movement. Tremor. Past pointing. 2. Dystoidochokinesia. 3. Hypotonia, nystagmus. 4. Dysarthria. Posture. Gait, ataxia.